If you're battling SIBO, you know the cycle. Antibiotics offer relief, but the symptoms always seem to return. But what if a natural protocol could match the effectiveness of the leading antibiotic, rifaximin? Here's the truth. Simply killing bacteria isn't a permanent fix. Standard treatments often miss the real reason SIBO started. This is how naturopathic medicine provides a missing link by complementing standard care to resolve SIBO for the long term. We will show you the tools for eradication, the strategy for fixing the root cause, and how to build a gut that prevents relapse. So, what's inside this powerful natural toolkit? It begins with highly effective antimicrobial agents. Herbal compounds like berberine, oregano, and neem are clinically shown to be potent SIBO killers, offering a strong alternative. This isn't a one-size-fits-all plan. Protocols are specific to your SIBO type, berberine for hydrogen and allicin for methane. For difficult cases, there's the elemental diet. This liquid formula starves bacteria while nourishing you, acting as a total gut reset. Alongside eradication, diet is a strategic weapon. A low FODMAP diet is for more than just managing your bloating. These diets methodically cut off the fuel supply for overgrown bacteria, reducing their numbers and weakening them for treatment. But even with these powerful killers, why do SIBO treatments sometimes fail? The bacteria have a formidable defense system. Think of a slimy, protective shield bacteria created to hide from your immune system and medication. This is a biofilm. Natural biofilm disruptors are a requirement for success. Specific enzymes dissolve this shield, exposing the hidden bacteria. So, ignoring biofilms is a primary reason standard antibiotic therapy can fail, leading to that frustrating cycle of relapse. Okay, we've broken their defenses and reduced their numbers. But how do we prevent them from growing back? The answer is to correct the dysfunctions that allowed SIBO to happen. This is the foundation of the naturopathic method. Meet the single most important factor in stopping relapse, the migrating motor complex, or MMC. It is your gut's built-in cleansing wave. Between meals, this wave should sweep bacteria down into the large intestine. In SIBO patients, this system is often broken. Restarting this wave is non-negotiable. Prokinetics do this job. Natural options like ginger effectively stimulate the MMC. Another common cause is low stomach acid. Acid is your first defense, killing bacteria before they can overgrow. Recall we said herbals can match rifaximin? When you add fixing motility and stomach acid, you get a truly sustainable strategy. But the approach gets more advanced. A feed-to-kill method suggests keeping bacteria active so they are more vulnerable to antimicrobials. And probiotics? Specific strains can actually reduce hydrogen gas, alleviate pain, and outcompete the harmful bacteria. To prevent bacterial adaptation, practitioners often rotate herbal antimicrobials. This reduces the risk of resistance. It is clear this isn't about one magic pill. This is a multi-layered system designed for your specific condition. A successful naturopathic plan is built on your SIBO type, your underlying causes, and your unique physiology. Let's connect this for the full strategy. First, biofilm disruptors break the shields. Then, antimicrobials eradicate them. Finally, prokinetics sweep the gut clean. This isn't an either-or decision. This is about synergy. Combining antibiotics with naturopathic support yields higher remission rates. There is one final step, repairing the damage. SIBO causes inflammation that can create a leaky gut and food sensitivities. This is why the final phase is focused on healing. Targeted nutrients like L-glutamine are used to rebuild the intestinal wall. We started with the idea that herbs can be as potent as antibiotics. We now see that as just one component of a much smarter system. It is a complete strategy. Eradicate intelligently, fix the root mechanical causes, and actively repair the gut lining. Naturopathic treatments are not just alternatives. They are necessary complements that address the why behind SIBO for lasting resolution. If you're stuck in a SIBO cycle, it's time to think bigger than eradication. A qualified practitioner can build a plan for your long-term health.